This is lecture number 5 in nu210 Nursing Concepts. We're looking at professional behavior in nursing. And as usual, we want to give credit to Dr. David Sharp for composing this lecture. These two topics, incivility and delegation, will be found in your Catalano text, chapters 15 and 16. First of all, let's look at the definition of civility. Of course, when you think in your mind, just right off the bat, what is civility? Just take a few minutes to ponder that. And then, of course, the textbook definition is civility implies taking actions that fight injustice and oppression while at the same time respecting others. Sounds like a perfect definition. All human beings are important. As nurses, we need to be civil to everyone. And of course, the Civil Rights Act of 1964 determined that everyone has equal protection under the law. And if you know our history, you know there was quite a few battles and skirmishes that took place to win that Civil Rights Act being passed. Especially down the South, we remember it, the southern part of this country. And it makes quite a bit of common sense that we should, as altruistic nurses, fight injustice and oppression, but we do respect the opinions of others. You will be working with many different types of personalities in the healthcare institutions that you'll be going out into, and you've got to learn to get along with everybody and treat everyone respectfully. Sometimes you'll see things take place that are wrong, that are unethical, and it will be your responsibility to report those things, yet you need to maintain respect for the human being. As professionals, we have to be civil to who? Well, we have to be civil to each other, those that you work with. We have to be civil to those students that come to our floor to do their clinical practicums, or with junior staff, our colleagues and other health professionals. That includes everyone that you work with in the hospital, whether it be the ward clerk, respiratory therapist, physical therapist, occupational therapist, or just the folks that fix the meals in the cafeteria, dietary nutrition. You need to be civil and professional towards clients and their families. Even if you think a family member is controlling or is not doing the best thing for the client, you have to respect them as their family member, and you have to follow proper protocols when you are dealing with these clients and their families, and when you are dealing with problems that arise in their health care experience. Because we're in the business of promoting positive health and a caring environment. That's what nurses do. We encourage good health, good healthy habits, and we provide a caring environment wherever we work. Now, when we're looking at interpersonal relationships, well, of course, what does that mean? That means relationships between individuals, not the relationship within you, but that which is between you and someone else, going back and forth. It's a dynamic thing. The key to nursing is to need to demonstrate that we care. We care about health, and we care about the well-being of our clients. All of those are predicated on excellence in communication and civility. Communication and civility. All communication should be civil. All of our behavior should be civil. When we are performing a skill on a client, we don't just look at them as just an object for a skill to be performed upon. We look at them as an individual human being. And we are definitely going to consider all of these interpersonal relationships as a key aspect of the term civility. What does it mean to be incivil, or what is incivility? Well, this emphasizes discipline, authority, punishment, and adhering to strict procedures. Sometimes there may be some intimidation. It might even be subtle intimidation, subtle or covert, an undercurrent of intimidation. There can be psychological abuse involved, horizontal and lateral violence, bullying. We've heard a lot about bullying in the past few years. It's something they are being proactive to get rid of in our school systems. There's relationship aggression. That could be spouse, could be mother-father, could be uh, father-child, father-daughter, mother-child-daughter. There could be workplace incivility and possibly mobbing. Well, what is mobbing? That's just like it sounds. When several people get together and act incivilly towards someone else. I don't even know if that's really a word, incivilly. Or they demonstrate incivility towards other people. New forms of incivility, cyber harassment. So that's because of our technology. We see that people are using the internet, social pages, email, um, tweeting to harass other people. The vicious anonymous emails. I don't know if you've ever gotten any of these. I really have never received a vicious one myself. All I've ever gotten are the ones that just seem to be always pestering me to buy something. How about inappropriate text messaging? Well, you probably shouldn't be texting with someone other than your friends, but maybe every once in a while somebody gets your number and texts you a very inappropriate message, whether it's just mean or whether it is hateful, rude, or sexist. Hate mail, rude, lewd acts. So hate mail, when you get hate mail that has these rude and lewd acts on it, I think, well, we all remember politicians that have been caught doing these things, texting horrible, horrible images. How about manufactured social rejection? What does that mean? Manufactured social rejection, just like it sounds. It's social rejection that somebody purposely makes up to be incivil towards another person. How about in nursing? You probably aren't familiar with this term yet, unless you've been in healthcare before. Nurses eating their young. Hmm. Maybe some of us have even been accused of that. I hope not. But what this means is that when student nurses or young nurses appear on the floor, there are some older nurses that have been there for a long time that are very, very grouchy. They don't like to get along with people. They don't like to have student nurses, or they don't like to have to teach other nurses that just came onto the floor as an employee. And they just chew them up and spit them out. That's what we call nurses eating their young. Then we're looking at an assertive versus aggressive or passive communication. Assertive communication is good communication. Aggressive communication may or may not be good. Aggressive communication usually is thought of in a negative light. Then there's passive communication. How about workplace violence? Something we never ever want to see in the healthcare setting is escalating violence or behavior in which one of our colleagues gets physically hurt. And you know, if this occurs in a hospital institution or a healthcare institution, there's a protocol that is followed. You need to learn that protocol when you're hired somewhere and be willing to institute it when workplace violence is witnessed or it occurs upon your own physical person. What is the golden rule that we've heard of so many times? Matthew chapter 7, verse 12, do unto others as you would have them do unto you. This sounds like a rule that needs to be followed regardless of whether you are religious or not. Now, ultimately, incivility may influence client care and safety. Very much so. Incivility can cause healthcare professionals to maybe forget what they're supposed to be doing for the client on a timely basis, neglect to do that. It may cause physical harm or emotional or mental anguish to the client. Incivility is controlled by social standards as well as professional and ethical standards. Of course, we as nurses, we follow a set of professional ethical standards that are delineated usually by the institution and their core values and their morals, also by our American Nurses Association, by the various organizations that are involved with nursing. They usually have certain ethical standards that they adhere to. But what are the social standards? Well, that is what the society as a whole or the local area that you live in accepts as good behavior or bad behavior. So they make the judgment call and they determine, and usually there are rules that are set in place to enforce these. Well, the American Nurses Association does have a code of ethics. And in number one, it states the nurse in all professional relationships practices with compassion and respect for the inherent dignity, worth, and uniqueness of every individual, and that continues. 1.5 says principles of respect extend to all encounters, including colleagues. 3.5 says nurse educators have a responsibility to promote a commitment to professional practice prior to entry of an individual into practice. And we very much follow that. Not only do we follow that, but we go beyond that by applying our religious Christian ethics and morals and beliefs in that we believe that you should treat all people as spiritual entities, as souls that are precious in the sight of our Creator. Therefore, we treat them the way that we want to be treated. Back to the golden rule there. And as a nurse or a student nurse, you have to demonstrate professional behavior at all times. And it doesn't matter whether you're dealing with your clients or whether you're dealing with your peers or coworkers or anyone in the healthcare system that is in an ancillary position or in the interdisciplinary team, whether it be respiratory, PT, lab personnel, even the housekeepers. You need to treat them with professional behavior and respect them. You should always recognize that professional behavior shows that you are a professional and that your demeanor is of a professional standard. That means that you are not incivil towards anybody. Your behavior is very civil and it promotes respect for all. You're never really off duty as a nurse. People are always going to recognize you as a nurse once you become a nurse. So you might as well just get used to that. It's just going to happen. People, when you go to your churches or to your various clubs or organizations, they recognize that you are a nurse and they always see you that way. And they'll ask you questions about healthcare. Just get ready for that. Learn the most you can. Never go outside your scope of practice. Always refer to those who would truly deal with that problem, but there are things that you can address as a nurse, especially if you decide to go on to advanced practice nursing, such as becoming a nurse practitioner or something. As a student, you need to represent the nursing profession at all times, and you need to remember that because you've chosen to come to Louisiana College, which is a private Southern Baptist sponsored college, you need to remember to behave in a manner that is conducive to our core values, our beliefs, and our mission statement. And that is to present Jesus Christ in everything that we do and to give honor to Him and the scriptures that we believe are truth. So be professional in the way that you speak with other folks, in your communication. Don't be loud. Don't be poignant. Don't be disrespectful when you communicate. Don't chatter. Don't gossip about your clients. Don't talk about your teachers behind their back. Don't talk about the healthcare staff that are dealing with you today. If you have a problem with them, then you take your instructor into a private place and you tell them and they will handle it. Don't get involved in cliques that are in the hall and talking about everything that's going on the floor that day. Just, oh, did you see this? That's so horrible what so and so did. And what about that patient? No, don't do that. Be respectful when you're dealing with your teachers, instructors, clinical staff, and clients. Always be respectful. Give other folks the respect that you want to be shown. Be honest and professional in your communications, whether it's written or verbal. You should be polite and restrained as well as objective. What we mean by restrained is that if you have an emotional peak of anger, disappointment, whatever, do not verbalize that. Do not write it. Take time to cool off, restrain yourself, and then get back at it. But be objective. Never ever be rude or disrespectful. Never ever to your clients, instructors, or staff in the hospital settings. Start to act like a nurse now. Determine that this semester you're going to behave in this professional manner that is conducive to nursing. Like you've heard it said, if it walks like a duck, well, it must be a duck. So if it acts like a nurse, it must be a nurse. You're just starting on this journey, but you can be considered a professional even as a student nurse. Now, after you graduate, before you are permitted to sit the NCLEX board, our dean of this college has to write to the Louisiana State Board of Nursing to confirm that you have the appropriate behavioral characteristics to be admitted to the nursing profession. So they don't just let that go as, well, they made passing grades, that's just fine. No, they want to hear from those who've been watching you go through this process, matriculate through this program, that you have the outcomes are shown, that you are a professional and that you behave that way and you have character and you have morals and ethics. See, that begins right now. When you decided to come and enter this program, we started that process. So, be the nurse duck. Start to walk and talk like a duck, like a nurse. You need to be professional. The way you dress, behave towards other people, that includes faculty and clinical staff, and when you communicate with others. Now, the way you dress is going to be according to the standards that we have delineated in the Department of Nursing Student Handbook that is made available to you. Usually your first day of this course, you get it, and it's made available through the nursing office. You sign for it. You sign saying that you will read it and that you will be familiar with the content in it, so that if you ever have a situation that comes up, you can refer to it. We even put in there how you should dress during clinicals, how you should dress when you are representing the college. We don't want you to look raggedy and holey jeans. When you go to the healthcare institutions to maybe work up your patient information for a clinical practicum, you have to dress usually in your white uniform, and you have to look like you're going to look the day when you come for clinicals. Passing nursing exams is not enough to just make you a nurse. You have to walk like a nurse and talk like a nurse. You have to be professional. You have to be compassionate, caring, respectful. Now, what would constitute incivility by a student nurse such as yourself? Well, let's just look at some simple, pragmatic concepts. Missing or being tardy for class or for your clinicals. Especially in the clinical practicum area, this can carry very, very serious repercussions. You could be failed for that clinical. You may have to make up the time, and usually the makeup work is harder than coming to the clinical. Now, of course, we're not talking about missing class or being late because there was a serious injury in your family or death in the family, etc. Or if you're sick with a fever and you're contagious. We definitely want to address those things, and that's called an excused absence, and you will be given work that will take the place of your normal work. Cheating, that's one thing we will not tolerate, any form of cheating. Many times, because we use the computer testing environment, folks are tempted to get together and to take tests together. We don't want you to do that. We want you to take your tests on your own. We don't want you to do screen captures of test questions. We don't want you to make copies of those questions. We don't want you to write them down and share them with other students. If you look in the student handbook and in the syllabi that we give out, there are serious repercussions for cheating. We will turn that over to the Academic Policy Committee, and they will investigate that and mete out whatever justice they deem as necessary in that. You may be dropped from this program completely, so we ask you, please do not cheat. Or refusing to participate in what's going on in the class. Refusing to do group work projects. Refusing to actually listen to and participate in the lectures. You could be called out for that. There are some instructors that if they see that you're not paying attention, they may purposely ask you a question. Then you'll be embarrassed because you weren't paying attention. That's happened many times. Refusing to participate in extracurricular activities, possibly also that are related to class, like skills lab or at clinicals. Coming unprepared to class or clinical. Well, if you come unprepared to class, you just may not look your best that day when you're called on to answer questions. It may cause you to struggle on a test, passing a test later. Now in clinicals, if you're not prepared, the instructor has the right to just send you home and you will have to make that up later. And like I said, the makeup is usually harder. And if you do that more than once, you may be failed in that clinical section. When you distract teachers and students because you use your mobile phones, your cell phones, texting, or using iPads to do social networking while we're in class, that's not civil behavior. That's not respectful to the rest of the class. Talking down to or demeaning faculty or other students, that can be looked upon as bullying sometimes if it's really serious. Um, Depends on how vocal and how outright and overt it is. Talking in a belligerent or disrespectful way to faculty or clinical instructors. Remember, you're a student nurse and you need to demonstrate professional behavior at all times by not being incivil towards others. Think about this question and jot it down, and then later share it on the chat board. What might student nurses get angry about? What might student nurses get angry about? Now, since we don't have groups in an online class, go ahead and just jot down your answers there, pause this audio, and then post it on the chat room later. What might student nurses get angry about? So go ahead and pause it, and then resume it when you're ready. Okay, let's look at another question that you can jot down an answer to and share with us on the chat room. How do you deal with concerns that you have as a student in a professional manner? How do you think you should deal with concerns that you have as a student in a professional manner? Pause the audio, write down your answer, and you can share it in the chat room later. Then resume the audio when you're ready. Now let's look at what the Joint Commission says about this. Quote, intimidating and disruptive behaviors can foster medical errors, contribute to poor patient satisfaction, and to preventable adverse outcomes, increase the cost of care, cause qualified physicians, administrators, and managers to seek new positions in more professional environments. Safety and quality of patient care is dependent on teamwork, communication, and a collaborative work environment. To assure quality and to promote a culture of safety, healthcare organizations must address the problem of behaviors that threaten the performance of the healthcare team. The Joint Commission is the agency that accredits hospitals and healthcare institutions in our country. They usually, I think, certify them for 5 years. They can do spot checks. They have all these rules that they come in and say, here are the rules, and they inspect the facility and they look for areas that the facility needs to strengthen, that they're weak in, safety things, etc. They're very, very much by the book, but they work with an institution to get them through that. They want them to be a good healthcare institution, and in order to accredit them, they must perform at a certain standard. Now, very important thing, delegation. What does that mean? Well, you probably in your life have delegated simple tasks. When you were overwhelmed and there was somebody that offered to help and you knew that they were able to do it, you let them do that for you. We're not talking about cheating. We're talking about sharing a workload as a team. And delegation is to look at all these things yourself does not mean to do them yourself. So, all these tasks that you have to do, when you look at them, doesn't mean you have to get it all done yourself. So that's why you have unlicensed assistive personnel to help you with. And there's other team members that can do it. An authorized person acts in the place of the registered nurse and carries out the tasks that fall within the RN scope of practice, but they must be qualified to perform the task. So, you delegate between RNs and LPNs, between RNs and UAPs, but you never give them something that's out of sight of their scope of practice. Now, when you're delegating to another RN, it's within your scope of practice and that other RN's. So it's something they're qualified to do. Now, this is a little different when you're dealing with ancillary staff that carry out tasks that fall under their own level of practice. So that's their job. This is your job. And as a healthcare team, you work together. But delegation means that you're working within people that are kind of under your scope of practice. Now, are practical nurses under our scope of practice in UAPs? Yes, they are. It's just a little more diminished in what they're able to do. So you don't want to give an LPN something to do that only an RN can do. Some places that might be composing the care plan or doing the headed-to assessment, pushing IV medications. You would not delegate this to an LPN. But if you were really, really busy and you needed to do those things, you could delegate to the LPN those things which they can do, and they need to be willing to do that for you. There has to be an agreement in place for you to be able to delegate this to them. Now, this concept of delegation is very important when we're looking at passing the NCLEX professional licensure examination, because you've got to know what to delegate. You've got to know that is a basic skill, that you recognize what can be delegated and what can't, because you'll be part of a healthcare team and you'll be a key player in that team. Many times you will be the head player. You will be the boss. You might be the charge nurse or the clinical coordinator for that whole floor. You need to be able to lead and to delegate. Now, if you delegate a task, the registered nurse must always supervise to ensure safety and standards are met. Then the RN considers to be professionals, therefore authorized to delegate independent nursing functions to other personnel. However, some functions cannot be delegated. For example, we cannot delegate assessment, care planning, making a nursing diagnosis, teaching, or discharge of a patient. Now, sometimes a free charge nurse who does not have a team of patients to take care of will do the teaching and discharge for the RNs. But that person is an RN themselves, and so they're able to do that. This is more or less delegation on an equal level, and it's sharing the workload so that all clients can receive equal care. And we look at the nursing process, and this is probably the first time you see it. That it first of all involves assessment. RN has to do that. The nursing diagnosis, the RN has to do that. The care plan, the nurse has to do that, RN. How about implementation of care? Now here's where we branch out. There are some portions of this that can be delegated. For instance, care may be feeding a patient. UAPs can do that, or family members can do that. How about discontinuing a Foley catheter, a urinary catheter? Many hospitals check off their UAPs so that they are able to do that. So that frees up the RN to do something else. But the RN has to come back and evaluate. And of course, the RN has to document all of that. So let's just summarize here. When we're looking at delegation, when we're using the nursing process, when a patient comes into your care, or when they are leaving your care, when you're discharging them, the RN needs to look after them. You need to admit them, assess them, and then assess them when you discharge them and teach them. On admission, they've got to be assessed, and you've got to come up with a care plan. We're going to learn over the next 2 years how to make a good, accurate, effective care plan. When they're discharged, you've got to teach them, and you've got to do the discharge planning. Well, there are many times now institutions have discharge planners for each floor, so they'll do that, but usually those are RNs themselves. Now, in between, you're looking after clients. Now, you look at the ones that are unstable and the ones that are stable, the ones that are acute, the ones that are not really that bad off. You would give and delegate care to stable clients, to other practical nurses, UAPs, other nurses, that, in other words, you don't want to dump on them. What you want to do is you yourself want to concentrate on the unstable clients and those that are acute. Give your stable patients care to those other than yourself. You can delegate their care to others. Now, this means that when you're implementing care, you can delegate only stable clients or those with chronic conditions. So don't dump unstable and acute clients on other folks. You've got to watch after them. That's your patients. The ones you want others to share in the care with are those that you have that are very stable and that have those long-term chronic conditions that are very familiar to others on the healthcare team. Let's take a look at this question. Which patient should you, as a charge nurse, assign to a new grad RN who is orienting to the neurological unit? A 28-year-old newly admitted patient with spinal cord injury? A 67-year-old patient with stroke 3 days ago and left-sided weakness? An 85-year-old dementia patient to be transferred to long-term care today? Or a 54-year-old patient with Parkinson's who needs assistance bathing? Now, according to the concepts that we shared with you on the first few previous slides, what do you think of these patients is stable and might be chronic? Okay, so take a look at that and then share in the chat room what you think is the correct answer. And then in the chat room, I'll get back to you and we will discuss it and we'll figure out what the correct answer is. Now, if you delegate a task, you as the RN for that patient remain accountable for that patient. So the American Nurses Association says that they agree that it needs to be stable, chronic, and you still must answer for that patient's care. There's no liability attached. The person delegated to practices under their own license. For example, if it's a practical nurse or within their own level of education if they're unlicensed. People are responsible for their own actions if delegated tasks. So in other words, if you delegate to someone who is lower than you in scope of practice, and they are able to do that legally, they're responsible for what they do. So if you delegate to an unlicensed assisted personnel, sometimes they call them CNAs or aides or PCTs, patient care techs, to discontinue a Foley and they go in there and do it improperly, they are accountable for that. If they do it wrong, cause harm to the patient, they are accountable for that. But you still remain accountable for the delegation process. Delegation must be appropriate or to educational level and skill set. You need to make sure that that person that you're delegating to is able to do what you're asking them to do. This is getting into the meat and potatoes of being a nurse. You will interact with clients and you will interact with other healthcare team members. You need to know your job and you need to know their job, what they can and can't do, and what you're supposed to do and what you can and cannot ask them to do. For example, if the client dies, the RN was accountable for the delegation. In other words, they had to give it to a person who was appropriate education and skill level. If that AP has accepted responsibility for the task, they have taken responsibility, therefore they are responsible for the death. If the RN delegates inappropriately to a person who is not qualified and the client dies, the RN and the assisted personnel could both be held liable. The AP has accepted responsibility when they should not have. So when an AP says, well, I'm not supposed to do that, you need to say, oh, okay, my mistake. Let's not have you do that. I'll do that. You can do this instead. You don't need to give it to them to begin with, but then they have got to remember that they don't have to accept it if it's not within their scope or they can't do it, if they're not able to do that. Okay? If that patient passes away, which is worst case scenario, this is how they divvy up the responsibility. So let's look at a few guidelines for delegating. First of all, when you assess the client, that is the responsibility of the registered nurse. So determine, are they stable or are they unstable? Is it acute or is it chronic? If it's stable and chronic, then that person can be delegated to another team member. Uncomplicated and routine tasks performed without variation from policy or procedure, no nursing judgment required, that can be delegated. If it's a repetitive task, where the RN can be used more effectively elsewhere, then delegate that repetitive task. Some people might call it a mundane task. You need to know who's available. You need to know who can come and do that. You need to know what education level they are. What competency level are they? Match that to the level of care required and then know what these staff members are comfortable with. You pretty much need to know everybody's job description involved on the healthcare team. You need to know what your institution allows them to do. Don't expect them to do something that your hospital would not want them to do. Don't send in a PCT to hang a bag of fluids for you. Don't send in a PCT to give medications to a patient. Don't pull them out of the pics and say, oh, would you go give this to so-and-so? No, that's your job. That's your responsibility. That's outside the scope of practice for a PCT. You have to do that from start to finish. Now you can ask another nurse of equal education and competence level yourself to go do that process for them, but they would want to do it from start to finish for themselves. You don't pull the pills, give it to another nurse, say, hey, give these pills to Mr. So-and-so in room 235. If you need for them to pass your medications for you because you're really, really busy, ask them to do it from the start. Give them the medication administration record and say, would you go give so-and-so the morning pills? I really would appreciate it. Are you able to? And they start with the MAR. They go to the Pyxis, they pull it themselves, give it to them, and they can document it. You don't break the chain in that duty in performing that task between one person to another. Let the person start and finish in the whole process. Now, when you're looking at assigning a task to an unlicensed assisted personnel, the outcomes must be clear and predictable. We need to know what the end product is going to look like. It needs to be definable. It needs to be visible in our mind's eye. We need to see. So, there's a Foley catheter in room 232. You ask the UAP, could you please DC that catheter? They'll come look at the order, say, oh yes, I'll be glad to do that for you. You know what it's going to look like is that that patient, when you come back to see them, will not have a catheter, and they will be due to void, and they will be comfortable. There will been no harm done to them. Also, needs to be predictable and uncomplicated outcomes. That's what you expect after performing the task. You don't want to see complications or harm on the patient. It shouldn't require a lot of supervision. It should be something they can do on their own. You don't have to stand there over their shoulders for them to get it done. There can't be complex decision making in it. There doesn't need to be a detailed assessment of the client involved in it. So if you're feeding a client, a stroke patient with hemiplegia, well, we need to see, is that UAP able to perform that effectively? Now, we may need to feed that patient with hemiplegia ourselves. We may have to do thickening to it. We may have to make sure it's a period diet. But what if the UAP is in a nursing home and they know the geriatric process of healthcare and they're used to doing that? Well, they may be the best for that job. That's what you've got to determine. Now, if you're part of a healthcare team that has regular residents in a nursing home, it's very possible that the UAP does the best job of anyone in there of feeding those stroke patients because they've been with them for a long time. But you've got to look at each individual case. If it's an acute thing that has happened just recently, you may want to take care of that yourself, or occupational therapy may be involved in that. We don't know. Well, that's got to be special to the institution. But most of the time in a hospital setting, we don't want to give that stroke patient with hemiplegia to a UAP. So when we see these things, let's make a judgment. Let's look at all the things involved and then decide maybe this should be reassigned to somebody else. Find out who is trained to do this and delegate it to them. Now, a lot of times, what we do is we have to really, really seriously think about what are the questions that we need to ask when we are going to delegate something to someone else. We've got to decide how to respectfully ask the person what their skill level is if we don't know them. We've got to determine if they've got the education and the level of competency to do that. And what we'd like for you to do when you come together and you physically see one another this next fall in August, we're going to want you to begin to practice asking each other these questions. And don't be afraid to ask them, because that's the way you're going to determine how you're able to do delegation effectively. So that concludes this lecture.